So I'm going to get started. Hello, everyone who has joined us here today, and welcome to the first of a series of workshops held by the Healthcare Consumers Association and by me. I'm Dr. Mary Dahm, and I work at the Institute for Communication in Healthcare at the Australian National University. But before we get started, I'd like to acknowledge and celebrate the first Australians on whose traditional lands we meet today and pay our respects to elders past and present, and to any First Australians that are here with us today. I'm joining today from Ngunnawal country, and if you want to share where you're joining from, please feel free to pop it in the chat. So this is me in a very pixelated photo, I think. So I'm a senior research fellow here. I have more than 6 years of experience in running and facilitating consumer reference groups and academic settings and working with consumers in research projects. I've also been a health consumer representative myself, and I just want to share some of what I've learned from both sides through this workshop series. Just from hearing some of your backgrounds, some of it might be really basic for some and new for others, so please bear with it because we have quite the diverse group here today. My happy memory from last week would be that I went to the dentist for the first time since COVID hit, and he told me that I had the best gums he had seen in the last month. So take that for not going to the dentist for 3 years. So what are we doing today? We are looking at the consumer in healthcare research, and this is a bit of a short overview, just what the Australian research landscape looks like, what key terms are that researchers often use, and that might be a bit confusing because you've heard them before, but you don't really know what they refer to. We're going to look at the role that consumers can play and the different levels of engagement that you can have. Having a look at how we can work towards having the consumer experience as a researcher valued more, and finding your own expertise of what it is that you can bring and what can you sort of put names to experiences and knowledge that you have. And then also looking at how can you get involved, so what are pathways if you wanted to get involved more in research projects, but also what are best practices that researchers should be taking in involving or collaborating with health consumers in research. And so things that you can actually ask about when you are participating somewhere and you feel, I don't feel that is quite right. What are my rights here? What is the best practice? Before I start, I just want to acknowledge that there are several ways that we can refer to health consumers, and some people might have personal preferences as to what they would like to be referred to. But regardless of what your preference is, I really just wanted to remind you of this quote by Shakespeare and stress that the work and commitment from all of you is really amazing, regardless of what term you want to be called that. But just because I have to make this easy, I will be referring to healthcare consumers, patient advocates as consumers, just because that's one of the most used words that we have, and it's commonly known. Here's some of the others. So the word consumer, patient advocate, and health consumer representative, they can refer to individuals who participate in healthcare systems and who advocate for either their own needs or the needs of others. So consumer is probably the most general term. So if you look at the definition here from Health Consumers New South Wales on the screen, consumers are people who use, have used, or are potential users of health services, and including their family and carers. Patient advocates, on the other hand, specifically usually refers to someone who acts on behalf of a patient and ensuring that their rights and needs are respected. Whereas a health consumer representative is often then a step above a patient advocate, so to speak, because they're focused representation and advocacy, not just for one particular patient, but for a larger group of patients. And it's usually sort of thought as that it's their responsibility to bring their perspectives and experiences to decision making and the processes in the healthcare system. But like I said, whatever you prefer to be called, That's perfectly fine. I'll just be referring to consumers for the sake of clarity for the presentation and the workshop. So let's have a look at the Australian research space and landscape. And maybe starting, and I said before, this might be a bit rudimentary for some, but novel for others. But what is research? So this is the definition from the Australian Research Council. And it says that research is the creation of new knowledge or the use of existing knowledge in new and creative ways so that we can generate new concepts, methodologies, inventions, or understandings. And a way that we can do that is really on a basic level, 3 different types of research that we can do. So basic research is focused on increasing our understanding of fundamental principles and theories without necessarily having to have specific practical applications in mind. And this type is often driven by curiosity and a desire to increase knowledge for its own sake. And it can lay the foundation for future applied research, and basic research is often conducted in labs or academic settings. And basic research often leads into applied research. So applied research is focused on solving specific practical problems and developing new technologies or products or processes. So this type of research is often driven by practical needs, and it seeks to address challenges and opportunities. So it's often conducted in collaboration with industry or government partners, and it can involve testing or refining new ideas or coming up with prototypes. Oops. And then the third step is evaluation research, where it's really focused on assessing the impact or the effectiveness of a program or policy or intervention. And this type of research usually, if you think about it, so basic comes up with the new knowledge, applied is trying to find how can we actually use this in real life. Evaluation is looking at, does it make an impact? Does it make a change? And is it the desired impact that we want to? Does it meet our goals? Evaluation research is often conducted after a program or intervention has been implemented and then used to inform further decision making. So are we keeping it? Are we changing it? Are we improving it? And you can see how these types of research are often complementary to each other and work together to advance knowledge and to improve outcomes, not just in healthcare research. Then the steps in a research process are often familiar to a lot of people, but sometimes there are little steps that are missing. So if you think about it, you usually start with defining the problem and in looking really at consumers in research, what the goal is for consumers to come up with the problems, which actually is not a problem in itself because they know where the issues are usually. What us dry academics often do is just go and read the literature that's out there to identify what the problem is, or we know, oh, maybe I want to look up or learn more about this type of thing, and we go and read the literature to sort of find out what's already known and where are the gaps. And from that, we formulate research questions, or we develop aims that we want to have, or we set up hypotheses that we want to test. And once we have that in place, we develop a research proposal. And a research proposal or a protocol usually involves what our big question is, what type of people we want to get data from, what do we want to learn from them, how can we measure what we want to learn about, and how are we going to analyze what we gather in terms of data. Once we have that in place, we need ethics approval. And ethics approval, I often find, I know there's 2 people with ethics experience in the group today, but ethics approval is something that a lot of people tend to forget about, I feel, even though it's very important. And we're going to have a whole session on ethics later on in the workshop series as well. So once you got your ethics approval, which sometimes can be a very time-consuming process, which is, I feel, something that researchers sort of get to dread and people outside of research often don't really know about. But once you have ethics approval, you implement your research plan, which includes then sort of designing and implementing your experiments or collecting your data, analyzing it, and interpreting your finding. So we are right now in the teal and light blue section of this ring on the screen. And then we move into purple, which is reporting our findings. And that can be in a multitude of ways. So it can be in academic papers, it can be in talks. Nowadays, it can be part of science communication. So you might find research findings on YouTube or social media. It can also be in presentations. And this is something that is increasingly, and I like that it's increasingly done with consumer involvement. And I've also published a couple of papers with consumers already, and it's been a fantastic experience. Now, the next slide is going to just have a bunch of logos on it. And this is sort of what the Australian research landscape looks like in terms of what health-focused research is about. The health research in Australia is primarily conducted by universities or within hospitals and medical research institutes and industry. And they're usually funded either by the government or industry. And there's also some philanthropic fundings that's come through in the last couple of years. So the National Health and Medical Research Council, so the NHMRC, is the primary funding body for health research in Australia, and it provides funding for different things, specific projects, scholarships or fellowships for individuals. The Australian government also invests into the Medical Research Future Funds, and that's more geared towards new technologies and treatments and interventions. The Australian Research Council, the ARC, is actually precluded from doing health research in the sense of, or health or medical research in the sense of anything that is directly aimed at improving patient outcome is not allowed within the rules of the ARC, because that's the remit of the NHMRC. So within the ARC, the Australian Research Council, it's mostly basic science that gets done and some applied research. So some of the health communication research that I do has been funded by the Australian Research Council, but it's less common to have health-related things happening there. And then, like I said, there's also industry-funded programs. So if you look at things like Cochlear, that was developed here in Australia, or pharmaceutical companies that are developing new vaccinations or drugs, they usually have a lot of funds. And in terms of philanthropic organizations, you have things like the Perpetual Impact Fund or the Ramsay Hospital Foundation or other foundations that help fund research in Australia. So here's a bit of the background that consumers may not be as aware of as researchers are. There's usually regular grant calendars in a year. So a particular scheme might come up once or twice per year. And there's usual application rounds, and they can be as long as 3 to 4 months from opening to closing. They can also be as short as 4 to 6 weeks. There's different type of grants, like I mentioned before. So there's grants for individuals that are called fellowships, there's project grants, there's grants for industry collaboration. They have different names depending on the different funding body, obviously. But what they all have is deadlines. And the deadlines is really where the tricky part comes in terms of consumer involvement. Often researchers think about involving consumers too late, where they should adjust their timelines to start contacting consumers before the grants even open. So this is especially for the ones that are run on the regular grant calendar, because if you know something's going to come up, you can take first steps to get in contact with consumers that they want to be working with on that project. They don't have to wait until the grant has opened and everything is a frantic mess. Another thing about the background, and I spare you, I've looked for a screenshot of one of the submission systems, but I thought I'd spare you what that looks like. They're often really, really clunky, and there is so much paperwork. So an individual application can be as long as 40 pages. An application from an entire research team can be as long as 100 or 200 pages. So it is quite a lot of work that goes into it. And oftentimes we don't deal with the grant body deadlines, but also internal deadlines that the university gives us. So this is something for consumers to bear in mind. Oftentimes, researchers know when their grants come up. And if they come to you with a grant and it's like, oh, it's due tomorrow, can you look over this? I would be really wary. That there are grants that really only have a runtime of 4 to 6 weeks, where something like that might be a bit more expected, still not okay. But I just wanted to remind you of there's timelines in place, and researchers that really want to collaborate, they can adjust their timelines so that they can include consumers from the very beginning. Key research terms, and this is probably something that for some of you is good knowledge and for others is not. So really we need to know what we are talking about and making sure that we're sort of speaking the same language. So let's look at one of the key terms that often comes up, and that is data. So data refers to information that's collected for the purpose of analysis. And it refers usually to raw or unprocessed information. And this is collected for a specific purpose. And it can be things like numerical values or text or images or anything that can help you in terms of describing some aspect of the phenomenon that you're looking at. So can you, and we're probably going to use the chat for that, that's easiest. Can you think of some data that might have been collected from you over the years in a health context? So chat or unmute yourself and just shout out. I just can't see you.
It's Adele here. Well, certainly one's health records if you use the public health system.
So anything that is in your health record, anything that is routinely collected data, so to speak, would be part of data that is used. So that's sort of the most common one that I would think of everyone here has experienced before. Then the next slide is looking at evidence, which is often thrown around when it comes to putting in new interventions or explaining why the particular treatment is needed. So evidence really refers to the information used to support or challenge a hypothesis. And it can come from multiple sources, so it can be data, it can be research findings, it can be expert opinions. And it is the data that is relevant and provides proof to support a conclusion. Can you think of evidence that has been used to treat you? Anyone? So not data that has been collected from you, but evidence that has been used to treat you in the past.
I look at the evidence on my joint replacements on the adverse outcomes and how long they've lasted to see.
Yeah. So there's studies that you can draw on if you have trouble thinking of evidence. Like I've put the X-ray here, for example. So the X-ray itself is data. I've picked one that has a fairly clear break on it on the most outside, on the little finger, the whatever the bone. Like I'm not a clinician, so I don't know which bone that is that is actually broken, but I'm sure you can tell which one it is. See, for me, this picture is pure data. It needs an expert to interpret and to see the break, or to at least sort of tell you what kind of break it is and what bone it is. And this is what turns the picture from data into evidence, when you have someone that interprets it and can make it relevant for the conclusion they're drawing from it. Like I just said, there's different types of information that we can use. So this is not really the NHNLC level of evidence, but I couldn't find a nice pyramid in their document, so I've used this that I found somewhere else. It's basically the hierarchy used to classify the strength of evidence for specific health interventions. So on the very top is systematic reviews, and often systematic reviews of clinical trials, which are a bit further down. Then you go to cohort studies and case series. And if you do not have any of these levels of evidence, because no one has ever done a study on that, then you go with background information or expert opinion, which is interesting in terms of sort of looking at where some guidelines come from. For example, I was speaking to C from HCCA a couple of weeks ago at a conference, and we were talking about the guidelines for ADHD and where they came from, and that a lot of that was based on expert opinion, including consumers and people with lived experience, purely because there wasn't a lot of other sort of evidence available for that space. So we talked about data, we talked about evidence, and we've talked about how research creates knowledge. So knowledge really refers to information that has been verified and tested and validated through research or other forms of inquiry. And in the context of research, knowledge is often used to inform decision-making and to improve outcomes in a particular field. So research can address gaps in knowledge, it can replicate knowledge, which is quite important, because if you find out someone put out a study and they said, oh, if you do 10 jumping jacks a day, you'll live 10 years longer. That's a huge claim, and because we don't all gonna just jump up and do 10 jumping jacks, or we might not all be able to jump up and do 10 jumping jacks, you might want to find out whether that is really true. So you try to replicate the study to see if you have the same findings. And that's the way it sort of informs practice. But what I really want to draw attention to is that knowledge, it can also be used to broaden the perspectives in the fields. So if you include marginalized voices, and it's especially where the consumers come in, you can contribute to the body of knowledge that is out there. And your contributions are really, really valuable. Next on is quantitative research. Quantitative research is a type of research that involves collecting and analyzing numerical data. It often involves structured methods of data collection, so surveys or experiments or observational studies. And it can achieve a variety of goals. So it can test theories and hypotheses. So what's the relationship between two things? If I do jumping jacks, do I really live longer? And it can help to establish cause and effect relationship. It can also be used to describe patterns. So for example, if you smoke, you might get lung cancer. So you can look at sort of population data from a perspective like that. And you can also compare groups, so the non-smokers versus the smokers. And through this sort of detailed understanding of patterns and relationships and trends, you can then use quantitative research to test theories and make predictions about the future. And this is really often purely a numbers game. And in contrast to that, we have qualitative research. Qualitative research is all about understanding experiences and perspectives and behaviors of individuals or of a particular thing that you want to know about. So what happens in a particular context, it's not just the individual that you're looking at. It often has very thorough methods of data collection, like in-depth interviews or focus groups. It has ethnographic observation, which means you're sort of embedded within a particular setting. You're noticing what's happening around you, you're sort of playing fly on the wall. And in the analysis really looks for patterns and themes. And those patterns and themes can help achieve a variety of goals. So you can understand what the experience of individuals are, what the experience of groups are. You can identify cultural or social or historical factors. that impact on the experiences of individuals, and it can provide a better understanding of the context with which, within which individuals are situated. It can also bring really thick and detailed descriptions. So new insights about why is this working this way, describing a particular context. So if you look at the hospital pharmacy or a hospital room with patients, you can make really rich descriptions. Who comes in? How often do they come in? How often do they say hello? Do they even say hello? Do they address the patient? Do they introduce themselves? So these are all thick descriptions and data that we can collect, and that are actually then provide you with a more rich and nuanced understanding of individuals and their experiences. And then we have ethics, which I talked about before. So the principles and values that govern the research conduct, and that ensure that all participants are treated equally and fairly and respectfully, and that no one comes to harm. And a protocol usually goes with ethics, because this is the detailed plan for how you want to conduct your project, and you should not move on from that. You should really stick to it, and that's what sort of is approved as well. And usually it includes all these things that are on the slide here. My next point is looking at well, consumers in research. Why are they there, and what can be learned? So in 2016, the leading Australian medical and research funding body, the NHMRC, in collaboration with Consumers Health Forum of Australia, published a joint statement encouraging researchers to involve consumers in all aspects of their research. But consumer engagement is still not a mandatory funding requirement. It might affect the outcome of an application, but it's not a necessary thing. Funding is often not available for meaningful consumer engagement during the grant application preparation, which is a big gap. So even if you want to involve consumers, and you might be really lucky and you find people that do it out of the goodness of their heart and volunteer, but the best practice is they should be paid, just as the researcher is paid to prepare the application. So oftentimes what happens is that because there is no money to do it right, researchers end up doing it in a tokenistic way, or it's absent altogether. And Brett Schultz, who's a researcher here at ANU, really has called for researchers to actually be required to show, if they claim that they have co-design or co-production in their project, that they can show how they've done that, and what they've done to work through power imbalances in the work that they're presenting. But in terms of levels of engagement, there's multiple levels and multiple ways that consumers can be engaged. And strategically, you can think of it as either a top-down engagement, where the consumer is a participant in the research or a service user, or there might be a partner contributing to service planning. And then there's ground-up ways of consumer involvement, which really looks at consumers being the ones that lead the project. They come up with the questions, and they design the project delivery and evaluation. There's also been talk about continuums of engagement, and there are several continuums that have been put in place, and I'm sure there's more than the ones that I've put on these slides. But if you look at Bowen's continuum at the top of this, the top arrows on this slide, they go from a transactional relationship where the consumers are passive recipients of information, for example, if there is a new vaccine available or something like that, to transitional, where consumers become active and more involved, usually in sort of a consultation kind of way where they give feedback, to transformational, where there's an active partnership, shared decision making between the parties, and a bit of shared control. If you look then at the model from the Commission, which is the nice HCCA acronym, the Australian Commission for Safety and Quality in Healthcare. They added 2 more steps, which are delegation. So this is where the organization identifies an issue and presents it to the consumer for the consumer to make decisions or propose actions. And control, which is what I just talked about before, is where the organization asks the consumers to identify an issue and make all the key decisions in development of solutions to address. So you can see this is quite an intense, big range of things that consumers can be involved in. And here are just some examples. So you can be a research participant, you might be a reviewer of proposals or applications or ethics forms or study protocol, or you might be a researcher. And that would mean you assist or participate in data collection analysis, you provide insights for interpretation, you help in the dissemination of research. The other big step that people have looked at is sort of involvement in strategic governance. So you can be in a consumer reference group, or you can be on a project steering committee, an advisory council. You can, you can help with steering where something goes, and usually you would want to be not just one but multiple consumers in a situation like that. And then really what you want to do is to get to a citizens-led and consumer engagement. And when I say this, often really need to acknowledge that not every consumer wants to lead a project, but some do. And really, it should come now to a point where we have consumer-led development of guidelines for how consumers should be involved in health. And the role of the consumer should be expanded. They should be included in grant reviews. And Brett Schultz, who I talked to, has written a nice paper about that if you want to read some more. So what can you do? And I really like this quote by Ted Roosevelt, is do what you can with what you have where you are. What you have is worthwhile. And it really is important, as the Consumer Health Forum says, not just that consumer representatives to be seen and treated as people with expert skills and knowledge, but that you are experts and you have expert knowledge. You have knowledge that no one else has. So what can you bring? And now I'm feeling like I'm preaching to the choir because you know what you can bring. And you have all your personal experiences, you have cultural, language, and social context that you can draw on, real world context that you can draw on. So what I would like you to do, if you can, and have a smartphone handy, is you can either scan the QR code on this page, or you can go to slido.com and type in the code 7436. And I'd really like you to help me complete this word cloud to see all the things you can come up with about what your experiences are. So once you've navigated to Slido, I also popped it in the chat. And you can put multiple answers in as well. So you can start building a good big word cloud. Yes.
Mary, could you please copy and paste the link? I wasn't able to do it from the, of the website to get into it. Thank you.
Can you let me know if that works? So I can see that people are typing. Really, we're looking
Great,
for
thank
just a couple of words. Ah, here they come. Can you all see them?
If that help anyone, after you type, you need to add the response. So as long as you keep typing ideas, another space will pop up. But when you finish your idea, just only click send, and then it's when those appears.
Right, thanks, Anna. Oh, what are the things? Ah, here we go. So you got lived experience, you know what it's like to live with a disability, you know what it's like to be a carer, an immigrant. You can support patients with knowledge. You are the ones living it. Exactly. So I give you maybe 15 more seconds to add to that, but I just wanted you to see how big and different we all are, but that being different and having all these different experiences as a patient really is what you should value for yourself. That's great. I love this. I'll make sure that I'll share that with you after, so you can get access to this as well. Now, and I don't want to run out of time, but it looks like I might. So I'm going back to my slideshow. I hope, can you see the slideshow again?
Yep.
Yep, good. Now I just have to find my slideshow again. Good. So how can you get involved? I think you all got the slides as a PDF, and I hope in the PDF all of these are clickable links, because there are clickable links in this presentation. So really what you can do is find out what your local state consumer advocacy group is, or the specific advocacy group for your, if you're looking for a particular disease or disability, local health services and hospitals also often have a consumer group that you can contact. You can also often find them in websites and newsletters, and I apologize for the quality of these images. I had to downsize them because my computer didn't want to play with high-res images. And social media. So if you look out for social media and follow consumer hashtags, usually there's often opportunities that pop up that are paid. So before we run out of time, which I think is one of the really big important things that everyone who is a consumer should know about, is what the best practices really are, and really the difference that you can make. Not that I want to compare you to a mosquito, but you are not that small. You have the knowledge and the experience to make a change. So what I want you to keep in mind is something that often researchers have no knowledge about. But researchers should allow time to build respect and trust, and to encourage participation of community members and consumers, and to allow discussions and decision making. And really, really avoid sort of that last minute cold engagement that often happens with grants. You should also be respected for your time, the time that you need to provide valuable feedback. And there should also be time to build trust through transparent communication. Your role should be clear, your decisions and privacy should be respected, and you should be asked for your preferences of engagement. And a really good way to do that, if you're working on a particular project or in a particular committee or something like that, is terms of references, because they then really outline what the roles and expectations are for the different players. They can set out guidance for confidentiality. They can set out guidance for preferred methods of engagement, and that can include time and location or the method. So is it a forum? Is it something that happens face-to-face or online? Does it happen via social media? What are people comfortable with? What are you expecting? I've already talked about time, but your time and expertise should be valued and resourced. That means researchers and other professionals involved in research, they're paid for that, and so should you. And you should also be reimbursed for your time. So if you're sitting on a committee, you should be getting sitting fees. If you're participating in a project as a researcher, you should be paid for your hourly work. You should also be reimbursed for travel and transport costs, for any carer fees that you might have for respite care or childcare. Interpreters or translations should be provided to you. And you might also be reimbursed for things like needing your phone to access meeting, or your internet, or for the printing that you need to do. Then everyone on the team should learn from the experience. So it's not just you that should learn, it's also the researchers that should learn. And there should be capacity building, not just for consumers, but also for researchers, which is why I sort of set this workshop series up to sort of go both ways. I apologize, I only have 1 or 2 more slides left. I apologize if I'm going over time, but please bear with me. So you want to have support programs in place, not just sort of formal training like we're doing here in a workshop today, but also buddy programs or mentoring that goes on between team members in a research team involving consumers. And then barriers, and I know someone said they would like to know more about barriers, but barriers should be addressed. So what do you need in terms of access? What do you need in terms of language, translation, catering? What do you need in terms of culturing and dedicated support? Really, are materials presented in a way that are culturally aged and language appropriate? Do they explain important concepts the way that they need to be explained? Can meeting venues accommodate people that have mobility issues, or that are hard of hearing, or that are blind? Your diversity should be recognized, but at the same time, you should also know when you need to say no. So there's this continued problem of over-engagement, especially for people that are from marginalized groups, of people that are non-English speaking, that are Australian or Torres Strait Islander background, people that are young people from other marginalized group are often over-engaged and sort of sucked dry. And I think this is one of the most important ones in terms of power dynamics, is that you should not be alone. You should never be the sole consumer sitting on a committee, purely because you can be the most outspoken person on the planet, but groups often have these informal leadership structures and processes, and you might be uncomfortable to speak up and be involved in decision making or speaking on behalf of a group if you're the only person in the room that represents that group. So there should be at least 2 or more consumers backing each other up and helping each other not to be afraid to speak up. I really do apologize for going over time. We just had too much fun in our introductions. There's another slide that you have with your PDF that has references on it. If you have some time now, I'd really appreciate if you could scan that QR code to give some feedback on this first workshop. We really want to learn also things that we might be able to do better in the upcoming workshops. So I'd really appreciate that. I also apologize, which is something that I've learned for next time, maybe to ask someone to keep an eye on the chat for me, because that's almost impossible to do at the same time. If you don't have the handout yet, I don't know if Shivana's still here, but I'm pretty sure she would have sent, or she can send it out after the meeting, along with a link to the video for the recording. Research game changers. Thanks for Dimitra. I had no idea. I will include this in future references.
There are, I think it's actually organised by consumers themselves. So it's a really, they know I think there is a little bit of a focus on clinical trial participation, but they also have other opportunities in there as well. So I really find it a handy resource.
Oh, great.
Yes, I agree. Thank you, Dimitri. It's really, really great network. Brilliant. Thank you.
Right. I do apologize. This is the first time I've run this. People that are in my consumer reference group know that I'm a big person on time and not taking time from anyone. So apologies for running over, but I hope you had you enjoyed this and you learned something. I'll make sure and check with Giovanna that she sends out the PDF. And I will probably, for the sake of privacy, cut out some of the introductions that we did at the start before we put the video online. But there will be a video, a link to a video online coming through from Giovanna pretty soon as well. And I want to thank you all for your participation. Thank you for all your great comments in the chat. I'll have another look at those once I'm done and this is all saved. And thank you really for coming to this first workshop. I had a great time.
Thank you, Mary.
Thank you.
Thank you.
See ya.
Thank you.
Thank you.
Bye.
Bye.
Thank you.
Thank you.